Hello everyone, my name is Vanji Louise. I am here to present my bioethical case regarding life support on brain dead. I am here with Mr. Frederick Thornton, who will be playing the role of Senator Mitch McConnell of Kentucky. Hello, good morning, Senator McConnell. Thank you for allowing me this opportunity to speak with you. My name is Vanji Louise. I am a registered nurse advocate for Life with Dignity Health Partners. I am in contact with your secretary, and I gave her some literature about what we're going to talk about today.
Good morning, Ms. Louise. Yes, I have it here, and it's my pleasure to meet with you. Please continue.
Senator, allow me to present an overview of our company and what we hope to accomplish with your support. Life with Dignity Health Partners is an organization that facilitates and assists in the end-of-life stages of a person. The Health Partners team work together so that the dying process for the patient will be family and healthcare provider supported, focused with attention to physical, emotional, and spiritual needs, without, of course, the inappropriate use of life-extending technologies, and attentively supportive to reduce suffering. We also promote discussions with patients about their end-of-life wishes, as well as guide the families during difficult times to ensure that their loved ones' wishes and decisions are honored, to allow them to have a dignified death.
What exactly do you mean by dignified death?
Senator, we advocate for those patients who are in their dying stage, or even those who are already pronounced clinically dead. Some patients have written directives regarding their future care, but there are those who don't. Either way, we help ensure that their end-of-life rights and decisions are exercised. For those who have not formulated their living will or advance directives, our organization helps the families understand the clinical situation of the patient, the possible effects of prolonged life support, and the pain and suffering that their loved one is going through, the expected outcome, and explain the patient's rights to end their suffering, to die, to respect the patient's dignity as they face the end of their lives, and help the patient achieve a good death.
Go on.
I am here, Senator, because our organization sees the importance of this bill and would like to tell you how important Bill 7717 is for anyone who is going or may go through the end-of-life situation. If passed, this bill will allow the legalization of termination of life support on brain-dead patients, ending their unnecessary suffering, giving them their right to die, and have a peaceful passing. I am here to lobby for your legislative support in moving this bill forward.
Ms. Louise, do you know of any cases related to this bill wherein application of this bill would merit my consideration for support?
Sure, yes, Senator. If you recall, there was this controversial right-to-die legal case of Terry Chavo. This is a woman who sustained an irreversible brain damage after suffering from a cardiac arrest in her home in Florida in 1990. Terry had a massive brain damage due to lack of oxygen to her brain, leaving her comatose, which was later on pronounced to be in a persistent vegetative state after months of no improvement despite therapies and treatments. After years of being hooked up on life-sustaining treatments without any signs of improvements, her husband finally petitioned to remove her feeding tube to allow her to die, because he believed Terry would not have wanted to live in that condition, and also would have elected to stop all prolonging measures. Unfortunately, her parents oppose and argue in favor of continuing artificial nutrition and hydration. This case went on for 7 years of several appeals and federal government intervention. It went up all the way to President George W. Bush. After a series of legal back and forth, Terry's feeding tube was finally disconnected on March 18, 2005, and she finally died on March 31st, 2005.
I do recall that case, and I can see the relevance to what you're presenting here today.
Oh, Senator, there is also this ongoing case of a 13-year-old girl. She's 17 now. Her name is Jahi McMath from Oakland, California. She underwent tonsillectomy procedure on December 9, 2013, in hopes that she will be treating the sleep apnea. She was able to wake up after the procedure, but then suffered massive blood loss and consequent cardiac arrest. According to her doctors, the loss of blood circulation caused Jehi's whole brain to die. On December 12, 2013, her doctors declared her brain dead. But her family was informed that she was legally dead, and that as a result, life support systems should be discontinued. But her family refused to accept the medical declaration of death by neurological criteria, insisting that Jehi is not dead, and initiated legal proceedings to require the hospital to continue treatment. After a series of court battles, Jehi's body was released to Alameda County Coroner on January 5, 2014, who then released the body to the custody of the mother. Her mother moved her body to an undisclosed location. As we speak now, Senator Jehi is on tracheostomy and is being prolonged using her tube feeding. The court cases are still ongoing, and Jehi continues to endure her pain and suffering from this situation.
Oh yes, I have heard of that case also. It does involve a lot of controversy.
Senator, I tell you these stories because I would like to make clear the need for the law to terminate unnecessary life-sustaining treatments on brain-dead cases. These patients could have been spared from the pain and suffering that they endured for the sake of their families' wishes.
I'm beginning to see the importance of this bill and how there's a need for the law to be in place. Also to mandate cessation of life support and treatments to end those poor patients' suffering.
Exactly, Senator, exactly. Not only that, with this proposed bill in place, terminating the life support of brain-dead patients would also stop the pain and prolonged dying process, and the treatments that are now considered medically futile shortens the emotional and financial burden to the family, and most importantly, we respect the patient's right to die and honor the dignity and sacredness of their end of life.
Very well stated, Ms. Louise. Your presentation actually has allowed me to shift my position on this particular bill. Therefore, I am in support of this bill, and your organization have my word, and I will vote in favor of passing this bill.
Thank you so much, Senator. Thank you for allowing me to present and supporting our advocacy. I am leaving you this one-pager literature that gives you an overview of what I have discussed with you today. This is also my business card. Please feel free to contact me via phone or email, and I will be sure to get back with you for anything.
It's certainly been my pleasure, Ms. Louise, to speak with you today. I wish you and your company all the best in your future endeavors and cause. This is my business card. Please feel free to contact me at any time.
Thank you.
Thank you.